What's going on, everybody? I'm Doc John from Mobility Doc. Thank you for watching. Today we are going to tackle arthritis. It's been something that has come up a lot for the 14 years that we've been in practice, and it is an issue that is often poorly understood. And one of the most annoying pet peeves of ours is that we have all of these patients with arthritis that can still do the things they love to do, but they just need some kind of action plan, some direction, so that way they can get back on track. Instead of being told that there's just nothing they can do, it's just arthritis, and it just is what it is. If you can, take a moment, please, to subscribe to us, comment and share as much as possible. It makes a huge difference for us. We've been growing nicely, and it's because of you. It's because of our Mobility Doc community, and we just really appreciate you. So let's get into arthritis now. I figured we'd start very quickly by just going over the types of arthritis, so that way we can agree on some terminology, and then some statistics about arthritis, so that way you can have a better understanding of who gets it and the percentages, and how different lifestyle factors influence it. But then also what you can do to maintain it. And I'm going to loop in some other videos that will tag into here, so that way you know what you can watch next to help you. But first and foremost, let's tackle arthritis. So there are a number of different classifications about it. There's degenerative arthritis, there's inflammatory arthritis, there's infectious arthritis, metabolic arthritis, and childhood arthritis. That's right. There are 5 types of arthritis. So we can't just simply say that we have arthritis. Now, degenerative is the one that we're really going to get into today, because that is the home for osteoarthritis, which is a combination of a clinical condition as well as underneath degenerative, you can think of the wear and tear from living an active life. Under the inflammatory side, that's where you'll find your rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, those inflammatory conditions that often have autoimmune components to them that you need to see a rheumatologist for to help manage your own medication, things of that nature. Infectious is arthritis that comes after an infection, just like it sounds. The metabolic one is gout, which is something that comes up in here. Maybe we'll cover in another video. And then again, childhood is its own form of arthritis. So coming back to degenerative osteoarthritis, it's interesting because in the 14 years that I've been in practice and working with active lifestyles, at first osteoarthritis was considered to be age-related wear and tear. And it's not that that's not part of it, but apparently there is a growing amount of research that's showing people who have osteoarthritis, some of them are experiencing unreasonable, unexpected, difficult to explain amounts of wear and tear that can't just simply be because of age. And I've seen that in some of our patients who needed a knee replacement at 40, but then had to wait till 50 because of how long the replacement lasts for. And some of these people really didn't do anything. There's not a great reason for them to be degenerating. So degenerative arthritis speaks to people who have degeneration in the structure of the joint, in the cartilage, in the bone. They may have cysts, they may have changes in the shape of the bone itself at the joint level that looks like little stalactites and stalagmites, little pointy parts that are getting into the joint space, and the cartilage could just be completely worn away. But the space of the joint is no longer how it should be. What's pretty incredible is that the majority of people, the age range is strongly greater than 50 years old are the people who will have osteoarthritis. And typically you get that diagnosis because you're greater than 50. The pain in that joint has been reoccurring many times over. Normally there's an image, an X-ray, an MRI that helps to classify or define more clearly what's going on at that joint level. Characteristics that we usually see clinically are there's pain with palpation, so I press on it, it hurts. The range of motion is now affected, so you don't have as much range of motion. There may or may not be swelling, and what's really interesting about osteoarthritis or degenerative arthritis is that it doesn't feel better with rest. It actually starts to hurt more with rest. You have this what they call gelling phenomenon, where you're not moving, and then when you go to move, the joint is stiff. It has crepitus, or those snap, crackle, pop sounds, and painful and limited. And then once you get moving, it's actually quite better. So it's almost like malleable, that you need to, the more you move, the better it feels. The less you move, the more it hurts. And so 15% of the entire world over 30 has osteoarthritis. And again, the majority of being 50 or older. So you're watching this because you want to never give up on the things that you love to do. And largely that's why I'm making this video, because we don't want you to stop. The reason why you follow us, follow our channel, is because we are the people who help you to do the things that you love to do. And a lot of our people who've been fortunate to be active for a long time and been around long enough have some kind of history of injury. And unfortunately, with osteoarthritis, one of the greater predictors of osteoarthritis is that they've had some injury in the past. And having some joint-related injury actually can increase the likelihood of osteoarthritis by 300 to 600%, or 3 to 6 times more likely to have degenerative joint disease or osteoarthritis if you've had an injury. Now, that's where I want to come in with this thought that a lot of our patients who come to us may come to us after they've gone to an orthopedist or their primary care doctor, someone that has done an image and has said, look, there is this joint space that is now narrowed, you are missing a lot of cartilage, it is bone on bone is something that people will often say, and that's just sort of where they leave them off. It's not very useful or helpful. It's things that you probably had some intuition around, like you probably figured that the joint wasn't great, but because now that you have this diagnosis and because they said you have degenerative joint disease or osteoarthritis, they just leave you with like, well, you'll know when you need to come back. At some point, you'll need to have this joint replaced. We can't tell you when, but when you're ready, you'll know. And the thing is that's because there is a chunk of the medical community that just, they don't specialize in helping people to keep going, helping to keep the wheels on the bus for as long as possible. Even if your reality is you're going to potentially need a joint replacement at some point, that doesn't mean that you need it in this exact moment. And if you don't need it in this exact moment, this video is for you, because what I want you to understand is that the joint, even if it's degenerated, still has room to improve. And you just need to know how to work with that. And the reason why we created our video on primers and what primers are over a year ago, which maybe we'll update, but we'll insert here, is because the way to improve your degenerative joint, your osteoarthritis, is through primers. Because what you can do is you can improve the joint mobility of that area, of your knee, of your shoulder, of your wrist, etc. Because mobility, joint mobility, is made up of flexibility, stability, and strength at a joint. And there is almost always room to improve in flexibility, stability, and strength. And what we created over a year ago was a series of instructions and guidelines around what you can do. And then what we've been doing is creating videos for your hip, for your spine, for your shoulder, for your knees, for your ankles. We've created these videos, these primers, for those of you with osteoarthritis or degenerative joint disease and other forms of arthritis, to be able to have a primer to more greatly improve and influence your mobility. Because it's not just a matter of strength or just flexibility, it's a combination of these ideas. Primers are your path to improvement. And remember, just because you have bone on bone or some degenerative joint doesn't mean there's nothing you can do. It just means you need to do more. So I encourage you to, we're gonna put all of this in here and we're gonna create more videos about this, but what I want you to do is I want you to take a look at the videos we're gonna insert in the description below for the different areas of your bodies, and we'll also link as much as we can into the video here to just click on, but I want you to do that. I want you to find your area and start that area, and if we haven't created it yet, I want you to ask us for us to create that area. For example, a lot of people have been talking about wrists. I'm going to create a wrist degenerative joint video so that way you know what you can do. We're going to link into below into the description what you need to buy whatever tools you might need. Some of those we can offer you directly in partnership with those companies, and some of those we're literally just telling you where to go. We get nothing out of telling you to go to Hyperice for like Normatec equipment for the compression sleeves, for example. It's just a very good company and good product. So we appreciate you. I appreciate you listening to the end here. Make sure, like I said, you comment below and subscribe. And I appreciate you allowing us to help you on this journey. We want to be in your corner. We want to help shepherd you from this beginning to end. And even if we can't help you, we know where you need to go. So don't hesitate to reach out. Thanks for watching.